reporter for NJ Spotlight News in DC, and I am sort of sad to say, I'm proud about this, but also sad at the same time. I'm the only reporter with eyes and ears looking out for New Jersey down here in Washington. So I spend my days covering the Hill, talking with members of Congress, writing about federal law, federal policy, and really a boots on the ground approach to uh, what's happening federally and how it's affecting New Jersey. And we are going to dive, as you all know, surely, into a big topic that emerged last year and is going to be with us this year and in years to come, and that is cuts to SNAP. Um, if I think back to last summer, I spent a lot of late June and July before Congress passed this massive new law that we're going to really break down piece by piece to the extent we can. I spent a lot of that time sweaty, grimy, tired, covering the congressional process of assembling this bill that's now law. You've probably heard of it as the One Big Beautiful Bill. I don't use that in copy. I think that's just not only is it political, but it's just sort of a silly and misleading term. Um, anyway, this law is takes a deep cut nationwide to SNAP, which our experts will break down a little bit more, but takes a deep historic cut to SNAP along with Medicaid and is part of this broader erosion of the social safety net that the Trump administration and Republican allies in Congress have taken upon themselves. So, anyway, today we're going to do our best to hear from experts about exactly how they're analyzing this new law, how it will affect New Jersey, what they're watching for, and also really what stories we might want to pursue as reporters. What is affecting our state? What's affecting our local communities? What should we be paying attention to that we might be missing? So that's enough of me. We're going to just go around the room and hear from our three panelists who are going to give some sort of broad introductory remarks, introduce themselves, explain what they do, and talk about the incoming cuts to SNAP. So, Jamie, could you give us a sense of why you're here?
Great. Thanks so much, Ben. Thanks for having me. My name's Jamie Bissell. I'm a senior program officer at the Robert Wood Johnson Foundation. The foundation is a national health philanthropy based in Princeton, New Jersey, and we're working towards a future where health is no longer a privilege for some, but a right for all. And our goal is really to create a more equitable society for all centered in health and well-being. And we know that we cannot realize that vision of health and well-being for all when there are children and families in America struggling with hunger. So SNAP, which is what we're here to talk about today, is the Supplemental Nutrition Assistance Program. As Ben referenced, it's a federal program that provides food assistance to more than 42 million Americans, seniors, disabled, children, families, veterans, you name it, funded by the federal government and administered by the states. It's our nation's largest anti-hunger program, with an estimated 1 in 8 people participating on any given day. But in the bill, which Ben, like you, I don't refer to as the big beautiful bill, we'll just say in the bill passed last July, the Trump administration included significant cuts to SNAP, as Ben already referenced, meaning that millions of people are now at risk of losing some or all of their benefits. This law started to go into effect and will essentially take benefits away from people in two main ways. First, the legislation significantly expands what's referred to as work requirements for SNAP participants. Here are the facts about that. The majority of working age SNAP participants are already working. That's a really important fact. We also know that the work requirements actually don't work. They've been shown to increase the risk of hunger and actually reduce overall income. They do not impact employment, and they increase administrative costs. So despite this evidence, the administration is expanding work requirements in a few different ways. So starting this month, work requirements have been extended to 80 hours a month for able-bodied adults without dependents, and more people will be required to prove they're working. Caregivers of kids as young as 14, veterans, adults experiencing homelessness and their families, young people aging out of foster care, and some of these groups we know are especially vulnerable to hunger. Work reporting requirements used to be easier for people also who lived in areas without a lot of jobs available. But the new law does away with this, meaning that people could lose access to their benefits if they're unable to meet work requirements, even due to lack of work, childcare, etc. The second major piece of this law will make states pay more of the costs for the program. And we know that states are going to really struggle with being able to afford that. And I know my colleagues are going to talk more specifically about the impacts in our home state in New Jersey. Currently, the federal government funds SNAP benefits, and the federal government and then the states together cover the administrative costs. So actually the costs of implementing and administering the program. Starting this past October, states are having to cover 3/4 of the administrative cost. That's up from 50% of the administrative cost. And in October of 2027, states are going to have to start paying for part of the actual food benefits as well. Just how much they'll have to pay is going to be determined by what's called the state's error rate, with higher error rates corresponding to lower federal contributions, again, on the actual food benefits. Because of this change, all states essentially are going to have to spend more on SNAP. So in the coming years, states could be forced to scale back or potentially end their SNAP programs altogether if they're unable to cover these new costs. These changes are happening. They're part of the current law. And on top of all of this, we're seeing the administration directly attacking participants' SNAP benefits in other states. So the USDA is pressuring states to, we know, turn over personal data on SNAP participants, including names, dates of birth, addresses, social security numbers. And while many states have complied, the USDA is threatening to withhold SNAP funds for those states that are refusing. We're seeing this escalating, in particular in states like in Minnesota. This has escalated even further following the administration's accusations of fraud, with the aim of cutting of SNAP benefits to the state entirely. So we're seeing a lot of pretty egregious behavior on the part of the administration. These are unprecedented assaults on our country's most critical food support. Nobody's SNAP benefits should be held hostage to political attacks. And I just want to close by referencing a recent survey that the foundation conducted, where we found that there was a shared consensus amongst people, Republicans, Democrats, independents alike, that the government should meet the needs of its people. And the same research shows that we all want the same basic things. We all want to feel safe in our communities. We all want financial security and stability. We want to be able to afford our homes, and we want to be able to feed our families. Food is a common good, and if we don't live up to making it a right for all people, we will all be impacted. Families are going to go hungry. Communities and local economies are going to suffer. Food banks and churches are not going to be able to meet the need. These consequences are really dire, but they're entirely avoidable by investing in a program that we know works and works in really powerful ways. So I will turn it over, Ben, back to you.
Thanks, Jamie. That is a really good foundation, and you sort of looked back and also hinted at what might come. I know there was a hand raised. We will get to questions later. I should have said that and made that clear earlier. But right now, I would love to hear from the councilwoman about her thoughts on these impending cuts and what's going on in Trenton. Councilwoman.
Thank you, everyone. My name is Crystal Feliciano. I'm Trenton City Councilwoman at large. SNAP is, as we all know, very beneficial to many people because we have great food insecurity nationwide and in our city, right? And so when the bill came out and everything, I spoke out and said, our people are suffering already how much more do we have to go through? Not only in being a councilwoman within the city, I'm also a teacher leader at Trenton Central High School. So I get to see hands-on our students that come to school every day, our at-risk youth that are there, in addition to dealing with our people in our community. We have food banks that will help out, but they're under stress and pressure as well. The city, we are under transitional aid that we receive from the state government. So what that means is we are limited in how we can even exercise use of our funds for programming and ways to help our community. At one point, I had suggested that could the municipality even look back at our budget, which is about $280 million. Can we look back at our budget and do something with unexpended funds for positions that we had not filled to see if we could help fill the gap of the food shortages that people would need? Well, because of the fact that we are under the memorandum of understanding with the Department of Community Affairs, we could not even do that. So what does that look like? That looks like us reaching out to Mercer Street Friends and other food banks, and we're out in the park giving out this food to the people, right? But then what if people don't have transportation to get out to the park to get to the food? Then we have other places like Meals on Wheels that goes out to certain people that meet certain criteria that they will deliver food and everything to them. It is a misconception that many people on SNAP, they don't work, but they do work. People do work. And it's hard. Look, I make pretty good money, but I have bills to pay, right? That my revenue that comes in, my expenses are what they are. And my grocery bill is crazy sometimes, right? Just like my utility costs are high. Everybody needs help at some time. This cut to these people, the vulnerable, right? Those people that need it the most. When we look at our veterans, when we look at our senior citizens, when we look at our children, when we look at people just trying to make ends meet and get by, this is a significant strain because in a municipality like ours in Trenton, like I said, because we are limited to what we can and cannot do because of the type of funding that we receive, we have to rely on our state partners to do their fair share, right? To advocate, to get monies. We have to rely on the county to do what they can do. And I must say that Mercer County Executive Dan Benson has been a wonderful partner in looking to help the city of Trenton to move forward. But what do we do when we've reached the point that we can do no more? This is just unacceptable. People should not have to go hungry. People should not have to be out in the street searching and begging and pleading to get a bite to eat. We should have it. It should be available. They should not have to jump through extenuous hoops to try to get the basic necessities. Maslow's higher order of thinking would teach us that at the basic root, we need to have food, shelter, right? We want to feel safe in where we are. And cuts like this to programs like that, that removes that. And that's not fair to anyone, right? Because then what happens is we increase the need for people to survive. And then sometimes people move to unlawful measures to survive, right? So now I'm stealing chicken out the store because I want to eat, but you cut my benefits and I don't make enough to pay, right? So now we're doing different things that we might not want to do, but we're just trying to make it. No one should be in that position. Their mothers, grandmothers, grandfathers should be able to eat. The children should be able to eat. Our veterans, the homeless people, there's people, I mean, it's just not right. It's not good. This is my opinion. I'm out here in the streets with our people, talking to them and watching and hearing the stories. And I must say this. I knew that the impact was really great. We set up different food distribution events at different areas in the city to see the lines of the people coming out there, to see people getting dropped off and walking in walkers, wheelchairs, to watch them have to do that because benefits were cut, to read the reviews online of people saying we need something to eat, to see when the food pantries at the churches and everything. Calvary Christian Fellowship Ministries does food pantries all the time. Trenton Deliverance Center, food pantries all the time. There's different places that are helping. The Rescue Mission, everybody's doing what they can do. But we still need the financial resources in order to be sustainable to help our people to be able to just make it from day to day. Thank you.
There are a lot of things I'd like to dive into there, and we'll make some mental notes. But vulnerable groups, I think, is a theme worth holding on to mentally. both Jamie and Crystal mentioned that. But Gina, tell us a little bit about your work and what's running through your mind about SNAP too.
Yes, and thank you for having us here today, talk about this very important topic. My name is Gina Platanino, and I serve as the Director of SNAP Policy and Advocacy at the Food Research and Action Center. And we are a national organization that is focused on eradicating poverty-related hunger. In the richest country on earth, we have poverty-related hunger. I appreciate the councilwoman's talking points because I started out my career as a legal services attorney. So saw firsthand how my clients had to choose between food or medicine, food or shelter, food and childcare. And we say choose, but when you don't have a choice, it's not really a choice. It is the circumstances that you are being pushed to. At the federal level, I was privileged to serve the previous administration as a senior policy advisor for nutrition and agriculture for the Domestic Policy Council at the White House. And I was able to see firsthand the impact and the hard work that our state agencies are doing, how hard states are working in implementing this program and the national impact that this program has. In my current role, I get to work with wonderful advocates across the country in protecting and strengthening SNAP, including here in New Jersey, which has a great program of advocates. So what is in my mind? In my mind is the $2 billion, almost $2 billion that SNAP brings into the local economy here in New Jersey, because it's important to know that those funds go directly from the federal government, then to recipients, and then to local groceries. Local groceries, which are over 5,000 of those, which provide over 52,000 direct jobs, almost 2 billion direct wages, and produces over 2 billion direct taxes. What that means is that with these cuts, these retailers will close or will not be able to stay the door open. So that means that those wages, those taxes will be impacted. That means that the individuals that will purchase in those places will have to go further out. And I mentioned that. And that means that the municipalities will have less tax revenue to be able to offset the federal disinvestment that HR1 cost. Right. And so I say this because people
Just quickly, Gina, I'm sorry, HR1, for those who don't follow Congress obsessively, HR1 is the big law we're talking about. So take it away. But just to
Yes, I don't call it the other acronym. The bill is HR1. So I would say, so the reason why I mentioned that is because many people are like, well, I don't follow HR1. I am not on SNAP. I am not on Medicaid. I don't understand how that will impact me. Well, New Jersey, the way that is going to impact you is a third of your budget goes to healthcare. The next part goes to K to 12 education. For the first time in history, SNAP is a line item budget. You have 10% of people in your state going hungry. The people who are on SNAP are below poverty line. Even though 80% are working, majority of people who are utilizing SNAP are children. This means that generationally, we're going to have a weaker workforce. We're going to have individuals with more healthcare needs, but less healthcare access because of the 1 trillion cut in healthcare benefits that also came out of HR1. So we're looking at a very grim picture, unfortunately, in terms of New Jersey. And I do have to just call out because New Jersey is one of the only states that acknowledges that the very minimal benefit that the federal government gives, the $23, right? New Jersey gives it up to 95 because they understand that food is medicine, that food is shelter, that food is a basic human right, but they can offset the federal changes that are coming that will permanently cut people from this benefit. So as a whole, we are really just tracking the impact that this will have on New Jersey and municipalities, especially because New Jersey is county operated, meaning that they will have a double impact because those counties will suffer more, meaning they will have to raise property taxes. And as someone whose parents still have a home in New Jersey, I know my dad complains a lot about those property taxes. And so this is why we need to care about it because it will impact each of one of us individually in our community as a whole.
I'm going to turn right back to you, Gina, because you were laying out this pace of what is to come. So this is law, and there's nothing, this is baked in at this point. But what is going to happen first for New Jersey? What if you could lay out a series of events that will happen this year and have already happened in the fall? What is in this next period of time?
Yeah, so New Jersey had about 3 months, along with other states, to implement the changes. Jamie went through some of them, but some of them was beginning November 1st, decreasing some of the benefit amounts because individuals can't claim their internet expenses. Only older adults and people with disabilities can now automatically claim their heating expenses. So that meant that the state agencies has to do extra work. It also meant that individuals who were refugees, asylees, victims of war who have come to our country to seek a safe space and who have been waiting 7, 10 plus years for to be safe here were cut off unless they had a green card. But we also know that green cards are taking a very long time. So those people were cut off from SNAP. They were cut off from healthcare. The other thing that started implemented is what Jamie talked about is these time limits. And we call them time limits because that means individuals who are 18 to 64. That grandma who retired at 62 because she couldn't find employment, and I mentioned that because you mentioned vulnerable groups. We know women, particularly women of color, they don't do well in the labor market past 50. And so those individuals are now can only get SNAP for 3 months in a 3-year period. Parents and caretakers with children 14 and up, older adults, people with this, veterans, unhoused individuals, youth aging out of foster care, all of those people either receive a letter or receive a letter saying you can no longer get SNAP benefits unless you can show that you're working at least 20 hours a week. Doesn't matter if you're doing 19.5 or 19.9 or that you're commuting 2 to 3 hours a day, you will be cut off benefits. And so all of that tabulates into administrative costs and more staff time for the state agency. Among implementing all of those things, we had a federal shutdown where in the first time in history, SNAP benefits were not giving in time. During that time, the boss, which is USDA for the state agency, gave incorrect guidance multiple times, which meant the state agency worked overnight trying to implement that guidance. And why do I mention that? Because any sort of administrative issues that were caused because of that guidance, states will be held liable because of it, and which will increase their payment error rates. And I know I'm getting too much in the weeds, but those payment error rates will impact how much New Jersey will have to pay in terms of their benefit costs. So it was the worst case scenario that could have happened between July and December. And so New Jersey's been dealing with all of this, trying to figure out how do we lower down our error rates? How do we make sure that we give out benefits on time? How do we put out communication so that people are not confused? How do we make sure that people understand what the program is? And how do we outreach to individuals while at the same time making sure that we prepare next year because we're going to have less funding to support our staff and capacity?
The error rates, as Congress was writing this bill, now law, the error rates were a huge sticking point, and only some states will get penalized because of this. It's realistically, and New Jersey, to a sense, was targeted by Republicans because it had recently struggled with its error rate. That's a little bit more than necessarily we need to get into. But what budgeting, I'm going to turn to you, Councilwoman. Budgeting, how does this upend your world when you're sitting there with your fellow council members and you're preparing for what's coming down the pike? How do these snap cuts, how have they changed your process? What are you now having to account for that you didn't have to before this law?
Well, here's the thing, right? Again, we're on transitional aid, so we can only do what we can do. Our hands are pretty much tied when it comes to things like that, right? We get enough to basically function in the city of Trenton. The state actually takes up a lot of they have a lot of buildings that they're not even paying the full taxable amount on to even be in the city. So we're not getting the full tax benefit from them, right? So now we have to be creative and look at other ways. We're on transitional aid, meaning that we're supposed to be able to eventually take care of ourselves, lower the amount of money that we would get from the state. And don't get me wrong, we are very grateful for the money that we do receive so that we can function from day to day. The fact that we have to plan to move ahead, but plan to transition off, but work with what the state actually gives us to be able to move, to be able to take care of social services for homeless people, right? The partnerships that we have with the rescue mission and the like. Again, we can't plan and budget for food programs to give to people. But now, at the rate of medical expenses, what can we do with that? We have a Department of Health and Human Services. We're referring our constituents to different avenues to get them the help that they need. But the frustrating part is for us is that we're not getting our fair share from the state when it comes to certain monies that we could be getting to allow us a little more flexibility that if we wanted to create another shelter to house people, or we have a big immigrant population. So not only are we dealing with the food issue, we got ICE running through the streets. We have people, the kids coming to the schools that are scared sometimes to come to school. We got to feed them. So now we're trying to be creative. We have a teacher leader, Nicole Dent, who is a colleague of mine, that she actually created like this pantry where she had easy meals for the kids to make, where you didn't really have to cook much, and had people that donated things. That so when we went on Thanksgiving break and Christmas break, we were thinking about, here's some food for you to eat just in case you can't get out and get it, right? And that's the community stepping in to help where the municipality could not. And so we rely more on our nonprofit organizations that have the resources and things. Back to, like you said, about the budget piece of it, we try to be creative in as much as we can be creative, but there's just certain lines we can't cross and certain things we just cannot do.
Yeah.
And that is the unfortunate part about it, because we need the money to make it, but then some of our constituents need extra help to survive.
I just want to mention a few numbers broadly. About 850,000 people are enrolled in SNAP in New Jersey. That's out of 42 million nationwide. This is a program that, of course, dates back to Lyndon Johnson's Great Society, right? This was and there are programs that preceded SNAP, but this is a key pillar of the social safety net. Urban Institute, these numbers may be a bit out of date, but Urban, I know, put out some numbers showing that roughly 400,000 people could lose SNAP assistance within New Jersey. And I'm coming to you, Jamie, next, but I just want to mention these numbers because the program is not terribly generous. The program as is amounts to about $6 a day on average for food. I could not live, I could not eat $6 of food a day and get by. I couldn't make it. So let's just keep that so in talking about this policy. Jamie, tell us a little bit more about how vulnerable groups will be affected. Both our other guests, I think, mentioned this in particular, and Gina was also mentioning that military veterans, folks aging out of foster care, asylees, things will get harder for them.
Yeah.
What's going on there?
Sure. So, individuals, and Gina picked up on the individuals who've been granted asylum, who are refugees, including individuals under 18 years of age, are no longer eligible for SNAP. There's a whole host of other categories that are eliminated. And in addition, as we talked about, the elimination of the waivers for work requirements in areas where there is not a sufficient number of jobs to provide employment, that's no longer an acceptable exemption. So like you're talking about pretty widespread, profound impact. And then I just wanted to pick up on something that you said, like you show me a place in the US where you can eat well at $6 a day. I mean, we're talking about a small amount of additional resources to supplement people's already very limited budgets. And in addition, what this bill also did is limits future reevaluation from increasing the cost of what SNAP is based upon, which, not getting into the weeds, but it's called the Thrifty Food Plan, and it's thrifty at best. And so it basically doesn't allow for sort of a reevaluation, based on inflation and a whole host of other factors. Because again, like we're talking about such a limited resources at the end of the day. It's generally, again, like for a family of three, the poverty line, I believe it's like $2,000 a month. And so it's like people who do not qualify for SNAP, all people without, documented immigration status, many immigrants with lawful immigration status, some students who attend college more than half time, and certain other people in states that don't qualify. So again, like you're already limited with who's qualifying for the program. Now we're talking about huge additional limitations. And then, one other thing that I think we should also reference here that's we don't know exactly where this is going to shake out, but I think Gina, you probably have better intel on this, but in the next few days we're likely to see a rule around what's called broad-based categorical eligibility. Now that's something that is a policy that essentially has allowed states to automatically qualify households for SNAP based upon them receiving other benefits, non-cash benefits. So as an example, Medicaid. If you're on Medicaid, then you automatically could be enrolled in SNAP. That's likely to also be eliminated. So again, we're making it much more complicated for kids, families, seniors, veterans, all of these different populations of people to actually access a program that they need.
Yeah, it's been. I'm gonna please pick up where Jamie left off, but it is worth noting this is a wholesale undercutting of the social safety net, right? It is not just SNAP that has been cut by this law. It's Medicaid as well. And interesting contrast when you listen to the Secretary of HHS down here in DC, Robert F. Kennedy Jr., talk about making America healthy again, while the administration is cutting SNAP benefits. But yeah, Gina, what pick up where Jamie left off there, if you could.
Yeah, and to your point as well, and also healthcare. I think we need to say that as well. It's healthcare, and I say that because one of the things that we talk about SNAP is that people on SNAP are less likely to be long-term hospitalized. They're less likely to go to the emergency room. We know that the worst health outcome is hunger, but when you intentionally target the program to say people can't have that, what we're going to see is, for example, in Oklahoma, they did eviction tracking, and during that 1 month where people didn't get their benefits on time, they noticed that evictions rates rose. Right. And we're going to see in New Jersey in the spring, when these time limits, people are cut off permanently, we're going to see an equal amount of people getting more eviction rates, making it higher. So it makes the councilwoman and the mayors and town managers' job harder. So towards what Jamie was saying, this isn't the one thing. This is part of Project 2025. They really have been filing this agenda of how do you curtail the program even more. And Jamie talked about making it more difficult for people to be part of the program, but also categorical eligibility. It saves the state money. Because you don't have to go to various hoops. And I talk a lot about money and funding because that's what, the state budgets really talk about. Yes, it's like, how do we make sure the program is running more effectively? And so categorical eligibility allows states to be able to do so without having to make individuals jump through many hoops. And it costs, the last data, I was looking at data just now, is it makes an application having to go from an hour to 4 hours. That means someone's time, right? It means like millions of more dollars having to come from the state to be able to do this at the same time when states now are going to have to cover an additional 25%.
That's a really good point. We think a lot of these federal programs are administered top down by Congress, by agencies, and they sort of are set in stone. But really, the day-to-day work is carried out by states. I'm curious, Councilwoman, if you are seeing any warning signs? Listening to Gina talk about that Oklahoma example with the eviction is real. That caught my ear. Are you seeing or hearing from colleagues about, and granted, the administration federally has been doing an absolute ton, so maybe it's hard to pin something specifically to loss of SNAP benefits, but what are you hearing just anecdotally about hunger in Trenton?
So I can't say that it would be attributed to any SNAP loss benefits, right? That I cannot say. But I can say that people are complaining just by way of maybe not having jobs, not having opportunity for jobs, the transportation, that they're lacking when it comes to the ability of fending for themselves, when it comes to getting an adequate amount of food in the house, and when it comes to basically surviving in where they are in the house. So lately it's cold outside, right? It is very cold outside. I was in Newark for the last couple of days, but while there, I received so many calls and messages because a councilwoman's work, right? A council person's job, when you really are into the people, it's never done, right? No matter where you are, and people have needs, and we're there to meet them. About a senior citizen apartment building who they had no heat. And so I'm working on these people need heat. What are we going to do? Waking up the got to get it in. You got to fix this. People turning on stoves just to make it. The fire department coming out because now there's this smell of gas all over the place. People getting nervous about stuff. Then we have the people that are outside that are homeless. Then we have the people that have the slum landlords that aren't doing anything for them. And then because they're upset because of the fact that we put a cap on the rent increase that they can impose, they're trying to find ways to evict the people to put them out into the street. These are things that we're dealing with not because of SNAP, but just because of life in and of itself and just the different conditions and things that are happening. So just because there are people that have a place to stay, they're grateful to have a roof over their head, but it doesn't even mean that it's the greatest roof that they could have. And then on top of that, when we're putting up information about you can get food here, again, not everybody has transportation to even get there to get it. So now the city, in my opinion, now we start to think about how do we start, if we were to do anything, transporting the people to try to get to the food, so that they can have it and bring it back, right? And so we have different senior citizen vans and we have recreation vans that we could use. Do we start talking to the churches and stuff to say, can you help us out to pick up, you know what I mean, to get them what they need? It's just us just relying on community at this time to just help us do that. But people are out in the street, not necessarily because of SNAP. It's just
Right.
because of lack of funding resources with jobs and everything to help them day by day.
But there are all
And Ben,
these.
can I just pick up on one thing the
Sure.
councilwoman said that I think is really important? Like the fact is we cannot rely on the emergency food support system. Like that is not tenable, like long-term solution here with
Yeah.
churches and synagogues and community
Hmm.
supports, like critically important and saving the day every single day. And yet we
That's right.
know that for every one meal that an emergency a food pantry, food bank, a church is able to provide, SNAP provides nine. And so again, I think it's just really important to lift up just like the power and the reach of the SNAP program. And we
Yeah.
can't continue to put this on the shoulders of like all of the extraordinary people out there working on the ground to help their neighbors and help their community. But it's just not like it's not a long-term solution.
No, there are two more themes I want to touch on before we get to questions. One is nutrition, and one is the cost to New Jersey and what New Jersey can do. But listening to you, Jamie, just now, am reminded of reporting last fall about SNAP cuts and the shutdown. And I was talking with food banks and farmers, and they were saying the demand now was
Yeah.
higher than during COVID-19. So store that away for what it's worth. But Jamie, on nutrition, I'm curious about shelf stable food, right? This is like a can of beans you can put in your kitchen, and it's good for years and years. What happens to nutrition when SNAP loses funding?
Yeah, I mean, we could say it across all of the food and nutrition programs. Like when these critically important programs lose funding, like you have kids that are not going to be able to grow up as healthy. They're not going to be able to do as well in school. You have families that are not going to be able to stay out of poverty. You have small businesses and farmers that are not going to be financially solvent. So again, like, I'm glad, Ben, you lifted that up, because this is a program that improves food security. This is a program that lifts families out of poverty. This is a program that ensures healthful diets for people. This is a program that decreases healthcare costs. This is a program that shores up financial stability and security, and it frees up money for other essential needs that families have. And so, like, when we think about these cuts, it's just the profound, like, dominoes. Like, we are going to have a generation of kids that are going to live sicker maybe and die younger than their parents as a consequence of this.
Um, Gina, just a final question before we talk with the group. What are the options? This is sort of a boring but really, really important question. What are the options for New Jersey? Because now they're going to have a bunch of costs. We're talking billions of new dollars worth of costs, as I understand it, that once had been shouldered by the feds, now are on the shoulders of New Jersey. What can you do if you're New Jersey?
I say New Jersey and across the country. I know, like Ben, you talked about like the law passed, right? We also know that laws can be taken back a bit, right? We saw this administration getting rid of many laws and trying to get rid of many more. Equally, it can be done, really sort of alerting of what the impact has. What else can be done? Progressive tax reform. I know that's something that people really have issues with, but I think it's important for us to look at our tax system. New Jersey's getting double hit because not only are they getting these federal cuts away from like healthcare, from higher education, from SNAP funding, but then it's also getting all this other money where millionaires and billionaires and high corporations who hire a lot of these individuals who are on SNAP because they're not paying them livable wages are getting tax write-offs. So there's less money where they could be taxed, right? So New Jersey has to figure this out. So it has to be like progressive tax reform and to what are our values? What is New Jersey looking at of how to fund it? Because I think Jamie said it best. Like, if we don't have this program, keep in mind, majority of users for SNAP in New Jersey are kids. That means that their parents are having to swallow their pride, submit a 20-page application, be judged, even though they're working one or multiple jobs because they can't offset. The way I think it's important to describe this is you're getting the same paycheck, but you're getting more responsibility and less resources. Food costs more, 2.7 was the last Labor Bureau statistic that it was showing us, 2.7 more than it did this time last year, right? Employment, people who are in a part-time employment want to work, but they can't find employment. New Jersey needs to figure out, even though with the federal limitations and the federal disinvestments, how do they support their workforce? How do they make sure that the companies are hiring that also got huge tax write-offs are utilizing that to pay people the wages that they need, so they can also do their part? It needs to continue what it's doing now, prioritizing their constituents. I can't say enough about making sure that the minimum is 95. That is huge because $23, it's nothing. And making sure that you're not making it more difficult for people to access, because that's what we're seeing across the nation. The other states will make it more difficult for the program to access. And as Jamie said, this is an economic driver, and New Jersey can't afford to lose more funding.
I am going to keep us moving along. I hope we've this feels very information packed, and I hope folks have taken good responses out of this for potential story ideas. But I'm just going to go from top to bottom to the extent I can with questions. This is a question from Mohsin Zahir of Urdu News, I believe, and I'm going to cut to the chase here. But what is basically, just given SNAP and eligibility, what is your advice? I'll turn to you, Gina. Maybe you have a good answer on this. What is your advice to the immigrant community on this issue, on SNAP and eligibility?
So undocumented individuals have never been eligible for SNAP. Humanitarian-based immigrants, those who are refugees, asylees, have been cut off. Majority of people on SNAP are U.S. citizens. They're also part of the white community. So almost 96% of people are are U.S. citizens. So the very more small amount who are in mixed status households with U.S. children, it is not a public charge. People can continue utilizing the program. New Jersey is one of the states that also follow litigation to protect data the USDA was requiring so there wouldn't be share around. So the best advice is you know your own circumstances. They already have your information, and you need to decide what is best. And respectfully, I say that because it's a tough decision being in America and being an immigrant.
Gina, again to you. Could you explain in more detail how cutting SNAP benefits would force counties to raise local taxes?
Administrative costs. So it's two ways, right? It's the administrative cost. New Jersey is county operated, meaning that they're responsible for the administrative costs that it costs to run. Last year it was about 180, almost 200 million, right? When you take a $200, so when you look at that, there will be an increase of 75%. That increase has to be carried over by the counties, which will be divided up. Not each county is the same in New Jersey, right? Some of them have more resources than others. And that's what we mean. Where will the counties get this funding? They can't raise taxes everywhere. Where will they get it? So that's what I mean, less resources. So maybe you are going to fix that pothole or create a new school system or better transportation. They now have to allocate that money just to be able to continue the program as is.
Yeah, so many stories are tax stories, as we all know. Jamie, for you, this is from Patrick of Edible Lehigh Valley. Would anyone like to comment on the moves to constrain SNAP benefits? I think from healthier options is a good way to phrase that.
So as of today, 18 states have submitted for waivers, essentially providing restrictions on what SNAP beneficiaries can actually purchase with their SNAP dollars. 32 states have not, although they're in the midst. So as an example, the state of New Jersey is actively working on a waiver that would restrict purchase of sugar sweetened beverages. So in other words, people wouldn't be able to use their SNAP benefits to purchase sugar sweetened beverage. I have a strong opinion on that. This is not the Robert Wood Johnson Foundation's opinion. I do not support the restrictions from a dignity and ethical issue. I think because you're receiving SNAP benefits, we shouldn't be limiting your choice. But again, I think the hunger community has been in, one place. The nutrition community has been in another place around SNAP restrictions, and they haven't necessarily been aligned. I do think that we have an important opportunity here, although not going to be funded federally, but we have an important opportunity here to a live experiment, if you will, around implementation of all of these different restrictions to really understand what the impact is on public health. So, but again, I lean on the side of being much more supportive around incentives. So like fruit and vegetable incentive programs for SNAP rather than disincentive. But again, you have 18 states that have submitted and received waivers. 32 states have not yet, but I suspect there's a decent amount of those 32 states that are in the midst of working on specific waivers that, again, would restrict what folks can purchase.
Sorry, can I just add that it's fiscally irresponsible at a time where states are struggling to run the program because restricting these items costs money. We know one state, it costs over $2 million, and we think they are under budget because they need to hire new staff in order to run it. And at a time when we're saying that states need to be able to come up with administrative support to put it in something that doesn't work because the diets of SNAP recipients are no different than anyone else. They're actually better. And we do know that when the biggest obstacle to a fresh fruits and vegetables is price. So it's most of the, administration figuring out how they lower down prices in order for them to be more accessible.
It's also one other thing I'll say, it's also completely wacky because every single state is defining things in completely different ways. So I have no idea how this actually gets executed at all. So it's a pretty chaotic situation at this point.
I'm gonna use my prerogative as host here to ask that what is the information that the Trump administration has sent out about how this actually will be carried out in real life? What have they told you? I'll go to you, Gina. You let out like an exasperated sigh. I could tell you have a good answer to this, but what have they said and what have they not said?
It varies by state. The retailers didn't get any guidance until 2 days before implementation. Individuals did not get guidance until they showed up to the stores. It really was more of a loyalty test. Red states wanted to support the administration. And I think the most important part of this is that this is another cut.
Mhm.
If retailers don't participate, SNAP doesn't work. So there may be less people in the program. So it's just another way to curtail the program. And my exasperation, I think it's, other administrations, including the first Trump administration, denied SNAP restriction waivers. And you can read their decisions that says SNAP restrictions don't work. They cost money. The diets are no different. We should invest in incentives. And this new administration is just taking it every other way and just trying other ways to cut people off the program.
I'm sorry, I'm not going to be able to get to all the questions, but there's one that stands out from Marianne. Um, Schools. What does this spell for children in urban schools and communities? Should school leaders look for, and can school meals supplement? And I'm going to turn to the councilwoman on this, given she wears a hat as an educator. What do you think of that?
I was going to jump in on that one because I actually read it. I was going to say,
That's
maybe.
all you.
So the thing is, it it is very hard looking at the children, some of the kids day to day as they come in. Most of my colleagues and I actually buy food and have it in our areas that we will give to the children to eat, right? And the thing is creating the environment where there is no shame in asking when they're hungry for something. I have kids that come by, hey, Miss Feliciano, I didn't have breakfast this morning. Do you have something? I mean, I have like Pop Tarts or fruit snacks or things like that, right? But we have things that we will give to the children. That's just out of pocket, just because, I'm a mom myself. And I wouldn't want somebody to overlook my child if she needed something to eat. Also, with the fact that we have a strong immigrant population that moves through our school, those kids are nervous about stuff. So we keep and do what we can within our capacity. So I'm not charging every teacher in every school to do something or put food in your room. But what I'm saying is we have programs such as Donors Choose, which they will give money, right? And they solicit funds from outside organizations to support projects that will assist teachers in helping build certain things in a classroom, right? So you can be creative. You want to build a mindfulness project or a warmth and relaxation project. There's a foundation right now that's giving $1,000 off the top if you're creating warmth or health in your classroom. So we need to become a little bit creative in how we move around and about to service the kids. Can the school meals supplement? I mean, they eat during the day, they have lunch and everything. I wouldn't be able to speak with that to how the board would allocate funds, but far as I know, there's nothing extra that's done. We just found out that through our contract with Aramark at our district, we can actually get extra snacks and food. Like if you have a after school program and stuff. And when I circulated that to the school body, the teachers were excited because they were like, "Oh my God, that's great." We look to get pack and go lunches or meals for the kids. And again, like I said, my colleague actually started a pantry. So I would encourage teachers that if you have, it doesn't have to be a big pantry, it could just be a cabinet. And if people want to get together and donate to give, then they can. That's not a permanent fix. And that's not anyone's obligation. But what can we do? That's what we can do. And also, parents and things can petition the board to see if there's something extra that they can do as far as their funding and everything goes to see about providing something more for the kids.
Sorry, may
I'm
I add? Sorry, Ben.
Yeah, yep.
We did a brief and a study that community eligibility, which is what provides those school meals, the breakfast and the lunch, may be impacted by the SNAP cuts. And Jamie mentioned categorical eligibility, which will make that less people will be eligible for SNAP or other types of related services. So that means that the reimbursement rate for the schools will be a lot more. So many school districts will have to drop off out of school meals. So
Mm-hmm.
the trickle effect continues both with HR1 and once the categorical eligibility comes out, we're going to see more school districts having to pay more and just having to say we're just going to opt out of the program because we can't afford it.
We are really cutting it close, and that's a good thing. I think I've packed a lot in here. Jamie, I'm just going to give one final, if you can make it brief, answer to you. This is from Carlos from El Latino News. Do you know why community organizations and food banks ask for identification from people who come to receive food?
Carlos, this is just speaking from my experience. I volunteer at my local food bank in Somerset in Bridgewater, and we just ask for address simply to check that the person is in the county. We obviously would never turn anyone away that needs food, but then for the next time, you need to go within the county. So that we don't ask any other information, but we do check the address to verify. I don't know now if that's sort of universal why Gina or Councilwoman. I don't know if you guys have a better, and again, this is just my experience.
Yeah.
So to that, with the food banks that we have around in Trenton and the programs that we do, we don't ask for any ID.
Okay.
We feed the people, and that is just what it is, right? Because we don't want anyone to feel discouraged from coming. Again, like I said, ICE is running around everywhere, right? So, and then even being able to advertise where you're doing certain things, like we have certain places that will give food away. I can't say where they are, but they give food away specifically to help our immigrant community, because we want them to know that we see you, we care, and you're safe, and we want you to eat as well. So we don't ask for any ID. We just ask for the people to be present and to come and get what they need to help themselves and their family.
There's definitely been a chilling effect though because of ICE, and we're seeing a
Mhm.
much decrease in participation over the last couple weeks, like when we are there on the evenings, for sure.
Yeah.
I want to thank everyone. This has been an action-packed hour, and I'm sorry, Abu, I didn't get to your question, and I'm sorry to anyone who did feel like they have questions still burning. Um, as I said, my job here is in DC, and I take sort of this federal perspective, but it's so lovely and wonderful to hear from folks who are deeper and more thoroughly covering New Jersey. This is going to be an issue that continues to burn slowly, surely, and yeah, I just personally am very touched with the councilwoman's mention in particular of the fact that she and her colleagues all have um, food food banks, little personal food banks. That's really wonderful. Also super grim. Shouldn't have to be that way. But maybe there you got me. I'm pro food. I'm showing my true colors as a reporter. Pro food.
The liberal media once again being pro
Again.
food. Thank you all
There
so
were some
much,
questions.
Benjamin.
Yeah, I'm just
Thank you.
questions about contacting
That's what I was going to say. Yeah. Sorry to interrupt you, but yes, I just want to let everybody know before you jump off. This was recorded. We're going to send an auto transcript to the journalists on the call. And if you wonderful people would agree to us sharing some contact information in case they would like to follow up, I'm happy to include that in the follow-up email. And if you need anything from the center, or if there's any resources we can help provide or direct you to, we will do so. We also are going to provide a fact sheet that we've prepared for all our press briefings in the follow-up email as well once the recording is done processing. Thank you to all of you. Ben and all three of our esteemed panelists. Keep up the good work and hang in there. It's crazy out there, folks. And we'll see you in the coming weeks as we continue to follow up on this.